Good morning. I'm Dr. Nicholas Jones, plastic and reconstructive surgeon, and I'm here in Atlanta at Lexington Plastic Surgeons. I've been practicing since 2014. I'm originally from New Orleans, and I graduated from Xavier University of Louisiana, HBCU, and we are #1 at putting African Americans in medical school and successfully completing medical school. I did my surgical training in Philadelphia at Albert Einstein, and then I went on and I did a microsurgery fellowship at the University of Mississippi, and I completed my plastic surgery training at Medical College of Georgia in Augusta, Georgia.
Perfect. Dr. Jones, well, thank you for joining us. Before we start, can you tell us what plastic surgery is?
So plastic surgery is a field of medicine that focuses on restoring form and function of every body part, which makes it very cool because no one operation is the same. And what I enjoy about it is I'm able to help someone, and the results are nearly immediate. Like the results of my efforts, I can see immediately.
Okay. So what would you say are the most popular kinds of plastic surgery procedures?
Okay, so today's time, probably I would say right now, Brazilian butt lifts are very common. Liposuction, breast augmentations have always been common, and in today's time, patients don't. Many patients don't want invasive procedures, so there's lots of non-invasive procedures such as Botox, fillers, cool sculpting, and various sorts of skin tightening procedures.
What's the difference between butt implants and a Brazilian butt lift?
That's a great question. So a Brazilian butt lift is actually a fat transfer. So instead of discarding the fat that we obtain from the liposuctioning, that fat is it's processed. You get rid of the fluid and the blood content, and then it's injected into the butt. Butt implant involves placing silicone prosthesis into the buttocks. Typically, it's placed within the gluteus maximus muscle.
Okay. Do you, so I guess let's go from the beginning with a patient coming in. So when a patient
Okay.
comes in for a consultation, what are some of the things that you're looking for to make sure that they are a candidate for plastic surgery?
Right. So first and foremost, when I assess the patient, I just want to make sure that we can safely complete the operation. That's the first thing. Can we get through the operation safely? And then the second thing I want to know is, can I provide them with the results that they want? Or are their goals realistic? And so when it comes to safety, basically patients come in, they're evaluated, we check, make sure they don't have, if they have any sort of comorbidities or medical problems like high blood pressure, diabetes, we want to make sure all of these things are under control, because most of the procedures that we do are elective, meaning that they're not necessary, they're not a life or death situation. So we want to optimize the patient's health and make sure everything is safe. And so if a patient has high blood pressure and we notice that it's elevated, typically I'll send them back to their primary care physician, or if they don't have one, we'll establish one, and we'll get these things under control, and then we'll go and proceed with the operation.
Okay. Is there an age limit for plastic surgery?
So there really isn't an age limit. It's more about your biological age. So you can be 75 years old, but if you're a healthy 75-year-old, you can successfully undergo an operation.
Okay. We do have a lot of questions, so I'll take that one
Okay.
real quick. One of the viewers wants to know if they are trying to remove stretch marks, what would be the best procedure?
So stretch marks are very difficult to deal with. And so typically there isn't really a great operation for stretch marks. Sometimes we can do liposuction and the skin kind of recoils and regains some of its elasticity. But there are some other procedures out, including like Selfina, that may help out with just stretch marks.
Okay. What about, so once a patient comes in and has the consultation done, let's say Brazilian butt lift, because you said that's one of the more popular procedures that people are getting right now. So if someone comes in for a consultation, how long between the consultation and the surgery usually takes place?
Okay. So what I'll do is I'll kind of just go back. Let me just go back a step. So
Okay.
let's say you come in for a consultation for a surgery. So I talk to you, evaluate you. I figure out if I can get you the results you want. You figure out if you actually want me to do your operation. Kind of give you a spill on, the potential complications, what to expect in the post-operative period, and then we, at the same time, we kind of make sure that you're safe to have this operation. So sometimes we may send you to get some labs done. You may need some x-rays. Most of the time you don't really need an x-ray, but we'll send you get some lab work and some preoperative work done, and we get that back, and if everything checks out okay, then we proceed with the operation.
Okay. And so with that procedure, what is the recovery time?
So for a Brazilian butt lift, I just seen a patient who's scheduled for surgery. So what I tell the patients is immediately after surgery, you go home. You may have some drainage, but I want them up and walking the same day because walking helps prevent blood clots. And as far as the recovery, they'll have a period where they're swollen and they have some bruising, and bruising kind of peaks around the fourth or fifth day, and the swelling eventually resolves. However, the final result, I tell patients to wait like about 2 or 3 months after all the swelling is gone, and then what they see at that time will probably be what it looks like long term. The other thing is that immediately after the surgery, their butts look really big because there's some fluid in there, edema, and just inflammation from the surgery itself. And then once that resolves, as well as there's a component of the fat that gets reabsorbed because all the fat doesn't take. Typically about 60 to 70% of the fat survives. And so what they see initially isn't what they're going to get long term.
Okay. With the fat transfer procedures, since it is fat in the body, if a patient starts working out, does that change the way that the results look, or can it take it away if they start leaning out? How does that work?
That is a great question. And so adipocytes are fat cells that you're born with. That's it. So once you remove them, they're gone. However, when your weight fluctuates, those cells will hypertrophy. They'll like get bigger. They can also get smaller with the weight loss. As far as leaning out, there may be some volume loss in the buttocks, but they're usually able to maintain the shape of their butt. However, when you lean out, the areas that have been liposuction, they tend to be more defined.
Okay. We have a lot of questions,
Okay.
So I'm going to pause my questions and ask some of the questions from the live.
Let's go.
All right. So the first one, is a full tummy tuck the only option for the skin left after weight loss?
No, that's not the only option. So it depends on how much skin loss you have. I mean, how much excess skin you have. Some patients, depending on their age and the quality of their skin, your skin has recoil properties like the elasticity. The collagen allows the skin to retract. So I have some friends that have lost over 60, 70 pounds and they don't have any excess skin. It just depends on the quality of your skin. But there are some non-surgical options for patients who have mild to moderate laxity, if you have. So there's radio frequency, and basically these agents or these machines, these devices, they're applying heat to the skin, and it's causing injury to the collagen, and then when it heals back up, it causes the skin to contract. But typically, if there's a skin excess or laxity, the best way to treat that is by surgical excision.
Okay. Next question. Does that body sculpting thing, I think it's the Cool Sculpt, work where they freeze the abdominal fat? Does it actually work? And how does it work, if it does?
So it works, but I think I don't offer it to all patients. It's a very select group of patients, and it's for patients who have focal areas of fat that they just some stubborn areas that they want to address, and typically like in the flanks or the abdomen, but it's not a substitute for surgery. And so the way that it works is by freezing. It freezes the fat cells, and what it causes them to die. And so your body just reabsorbs those cells, and typically it takes at least three sessions, sometimes even more.
So just to go further in that, who would qualify as a candidate for the Cool Sculpt?
So I would say someone that's close to their ideal body weight, like someone who may be a little bit overweight, but you can't. I wouldn't say someone who's morbidly obese or has a lot of fat deposits. So, like I said, just someone who's seeking improvement of some stubborn areas. And I think it's very important for prospective patients or the layperson to make sure, like when you go to these medical spas, a lot of times they offer you these treatments and they say, yeah, you're a candidate, you're gonna look great after, and then you spend $4,000 or $5,000 and you haven't got the results that you wanted. Then you end up going to a plastic surgeon and they offer you liposuction. He's like, well, gosh, I could have come here first and not had this problem.
Yeah. Okay. Next question is, I'm not sure what this one means, but is a breast lift as bad as an enlargement? So maybe, I guess that's harsh on the body.
So breast lift and enlargement, let me just explain. So breast lift is also called a mastopexy, and basically what that is reshaping the breast and changing the position of the nipple. So a lot of times after pregnancy or just aging, this tissue begins to sag. You lose some of the breast parenchyma, the tissue itself, and so sometimes it needs to be lifted. And oftentimes the lift alone may not be good enough, so you can combine that with an implant, and that's called an augmentation mastopexy. Augmentation's recovery time is a lot shorter than it is for mastopexy because it's a much smaller incision. The surgery takes less time, and so typically augmentation will recover 2 to 3 weeks. Mastopexy, I say 4 to 6 weeks.
Okay. Going back to the cool sculpting, because there's a follow-up question. So does that mean that cool sculpting is not permanent?
No, it's permanent. Like I said, once those fat cells have died, they don't grow back.
Okay. The next question is about liposuction versus a tummy tuck.
Mm-hmm.
Someone wants to know if they would be a candidate for it, but also wants to know what the differences are. Okay,
so when I see a patient, and I'm deciding whether they are a candidate for liposuction or abdominoplasty, it's really based on whether or not they have excess skin. If you have a little pudge, like you have a crease, like from a previous C-section, or a pudge just above your mons or your pubis, and there's some tissue overhanging, which is a pannus, you're not a great candidate for liposuction alone. And I would offer those patients abdominoplasty. And also, if you have a bulge, like when I'm examining a patient, I ask them to stand up and to hold their stomach in. If they hold their stomach in and it's pretty flat, and I don't feel any separation of the rectus muscle, then they may get away with liposuction alone. But most of the times in patients who've had children, they're older, the rectus abdominis muscle, which is in the middle, it separates over time. And so there's no way to get that stomach back flat unless we put those muscles back in the center. So even some patients may not even have much of a skin laxity. They may need some sort of repair of the muscle.
I want to talk about new mothers and childbirth, or not even new mothers, but women who have had kids, because a lot of different things happen to the body after childbirth.
Right.
So what are some of the procedures that are available, or things that moms come in for?
Oh, I would say the two most common procedures are breast procedures and abdominoplasties. So the breast procedures can be a combination of things. As we mentioned before, sometimes they just may need an augmentation because they want more upper pole fullness, or they just want their breasts lifted somewhat. Or some patients need a lift to just lift the breast back up to their pre-childbirth position, and then also they may need a combination of the lift and the implant. And as far as the abdomen, mostly abdominoplasties. Every time I do abdominoplasty, or I say most of the time, there is some liposuctioning involved. And the reason I combine the liposuction with the abdominoplasty is the flanks. I like to restore the silhouette. And so by liposuctioning the flanks, it sort of enhances the result. So they have more of a definition in the waist and a little bit curvier.
Okay. Can you talk about, so a lot of people go out of the country to get different procedures done, and the results vary. But can you talk about just the different pros and cons to that, if any?
Yeah, definitely. So the obvious advantage is it's cheaper. A lot of patients they go out of the country because they're saving money. And I think some of these surgeons, or some of them aren't even surgeons. They do excellent work. They have great results. But the problem is, anytime you have a procedure, there's always a possibility of a complication. And so if you have this procedure in Dominican Republic, they do the procedure, ship you back home, you're on a plane, you get back, you have a problem, who's going to take care of your problem? And I think that's the biggest con. You don't have the appropriate follow-up. There's no one to address your concerns. And so I think it's best for you to have those procedures done in the United States, where you can see a board-certified physician, a plastic surgeon, ENT, whomever, like myself, who's been trained, and we do these surgeries in a safe environment. And if there is a complication, knock on wood, I'm more than capable of handling it, and that's the main difference. Like even here in the United States, some people, they may go to a dermatologist, and let's say a dermatologist gives them excellent results, but that one patient that has a complication, they end up in the hospital. The dermatologist can't take care of them. Like, the dermatologist doesn't have privileges to operate in a hospital.
Right. So with one of the things you mentioned was cost, and actually people are asking about cost. So what are the approximate costs for different procedures?
Okay.
I guess you could do like the top three most popular.
So it varies. It varies which depending on which region you're in. For example, if you're in a place like Miami, the prices are lower. And the reason the prices are lower is because there's so much competition. But here in Atlanta, liposuction, for example, first area is typically $2,000 to $3,000, and then each additional site may be around $1,000. Abdominoplasty with liposuction, I say that's eight to 10,000. Breast augmentation, that's about 5,000 to 6,000. Augmentation with a breast lift, that's about $8,000 to $10,000.
Okay.
And so it just varies. And then the other thing, when you're taking into the price into account, there's two different prices. It's a combination of things. One, anesthesia. No matter where you are, whether you're in an outpatient facility, in-office facility or in a hospital setting, there's going to be an anesthesiology fee and a facility fee, and then there's a surgeon fee.
Okay, we have another question. I'm not sure if you can answer this one, but I'll read it for you.
Okay.
I need a breast reduction. I weigh about 150 pounds and my cup size is an H. What size should I go down to? I wouldn't mind being a D cup, but is that okay? What would be the recovery time?
So I can't really answer that question. I don't know which cup size would be appropriate for her. But the recovery time, I say about 1 to 2 weeks before you can go back to work. But as far as the healing process, 6 to 8 weeks, and healing for any procedure ends six months to a year. But after 8 weeks, I say it's probably stable. With breast reductions, a lot of times their insurance covers the cost depending on whether they have symptoms or not. And if their insurance doesn't cover it, it's usually like about $8,000 to $9,000. There's a scar. It's like a lollipop scar. There's a scar on the nipple, and it kind of goes under the breast. I think when you're selecting a surgeon, it's good to see their results. Ask as many questions as you can, and just to make sure that you're both on the same page. Because with breast reductions, there's many different techniques.
Okay. We have another question about tummy tuck and abdominoplasty.
Okay.
What is the difference?
A tummy tuck is the same thing.
It's the same thing. Okay, we had a few people like, what's the difference?
But here's the key thing with abdominoplasty. There's another procedure called paniculectomy. And the difference between abdominoplasty and paniculectomy is usually a procedure that insurance covers, and it's just excising excess skin and fat. Abdominoplasty is more so contouring the abdomen. And so in abdominoplasty, the muscles, the rectus muscles, your ab muscles that go up and down, we tighten those back up. We bring those back to the center. And then we also do liposuction, which help contour the flanks. And it's also excising the skin and the fat, or cutting it out.
Okay. I want to touch on the non-invasive procedures for a little bit. What are some of the benefits of Botox?
Botox, anti-aging. So your face has muscles in it, and so when you contract those muscles, it causes lines. Like when I raise my eyebrows, the reason I have those lines there is because it has a muscle called a frontalis, and it goes perpendicular to those frown lines. And so what the Botox does is it temporarily it paralyzes those muscles. And so when it paralyzes those muscles, it helps mask those lines. As far as aging, some people start taking Botox early because it does kind of help you maintain a youthful appearance for a longer period of time.
So how long does that last when you
use it?
Yeah, when you use it.
So the first time, I tell patients it'll last like about 6 months, but the more you use it, the life of the effects last a little bit longer. Now, if you have wrinkles that are static, like at resting position, the Botox tends not to work. Those would be patients who may need other modalities such as fillers. There's dermabrasion.
What are fillers?
Fillers, it's a combination of compounds. Like the main one is hyaluronic acid, and it's something that your body naturally produces. And so that's injected into the dermis. And basically what it does is it kind of masks or kind of lifts those concavities or lines that you may have. That's just one type of filler. There's also, you can use fat. You can do fat grafting to the face. And then there's a few others that we use.
Okay. What are some other non-invasive procedures that someone can get?
Okay, so here, I'll just tell you about a few that we have here. So we have a laser hair removal. We also have vaginal rejuvenation. It's a in mode. It's called in mode, and we have the fractura, and we have one other one. Forgive me, I can't think of the name, but basically, what it does is it helps out with vaginal rejuvenation by there's an internal probe and an external probe, and one helps tighten up the vault, and in addition to restoring the integrity, it also helps out with incontinence, but low grades like grade 1 and 2, and also externally the skin, the labia majora, minora, it helps out.
Okay. So what are some things, well, first, is there anything that we haven't covered that you think is important for people to know about plastic surgery?
Yeah, so just going back to safety. You know, cosmetic surgery is very popular in the States right now. I think with the advent of social media and celebrities, getting lots of plastic surgery, people are always looking for the best deal. And so a lot of times, because people don't really know the field that well, you end up being in the wrong hands. So I think it's really important to do your due diligence and do a check. Like make sure that the doctor that you're seeing is actually a doctor. It's very easy to do. Just Google the name. Make sure that they're board certified. And a lot of people say they're certified, but when I say board certified, basically they've been trained at an accredited medical school and done a residency. And especially for someone who's undergoing a surgical procedure, just say, hey, where do you have privileges? If you are my doctor and you're operating on me and you don't have privileges at a hospital, that's a red flag. If they don't have privileges, they're probably not a surgeon. Also, just go and meet your doctor, ask questions, and if you have any kind of inklings that or any you're not comfortable, then they're probably not the person for you.
Okay. I'm going to take one more question from the live. If you're diabetic type 2, can you still be a candidate for plastic surgery?
That's a great question. If you're diabetic and your blood sugars are controlled, yes, you are a candidate for surgery. So what we usually do is we check your hemoglobin A1C, which is a measure of how stable your glucose has been, and if it's under 7, we proceed with surgery.
Okay. Well, thank you for all of that great information. Where can people connect with you or ask you more questions if they have any?
So on Instagram, I'm Dr. Nippentuck, DrNipandTuck, and I'm practicing at Lexington Plastic Surgeons. We have a website, and if you're interested in a consultation, there's a number you can call that is 404-400-1230, and we have consultants here. We do virtual consults. We have patients from all across America, even from foreign countries who come and see us, and we'd be happy to take care of you. But if you have any questions, I'd be happy to answer those.
Perfect. Well, thank you.
Thank you.